I have the luxury of getting to introduce, as we all do, incredible founders, incredible businesses. And the next one is called MindMode AI. And the founder, CEO Correy, when I first met her, maybe a minute into our meeting when she was describing what she does, it instantly resonated with me. And I don't know if you remember this, Correy, but I said, I wish you were building this 3 years ago. I worked for this company, as Abel mentioned, called Achille, which was a video game company that built the FDA-cleared video game for kids and then adults with ADHD. In this company, we raised like $400 million and unbelievable teams of brilliant scientists and clinicians and commercial experts. And I don't know how we missed it, but in hindsight, it was so obvious. Couldn't get the kids to keep playing the game, right? These are kids who clinically had an attention and focus issue, and we were asking them to pay attention and focus and play a game that was like a souped-up Mario Kart that was frustrating as all hell. And they all dropped off. We spent all our time optimizing for efficacy, and we forgot about tolerability. I wish MindMode existed because they play in that space. And I'd love to see what Correy's got to share with us.
Hello. Happy afternoon. Did you know that the healthcare industry loses $150 billion in no-shows every year? And behavioral health is 3 times the cause more than any other specialty. I'm Correy O'Neal. I'm the founder of MindMode AI, and we are solving the retention problem in behavioral health. The mental health crisis is worsening. I'm sure you have heard and seen in the news. People are struggling to stay on plans. Yes, they're seeing talk therapists one-to-one. Yes, they're participating in group programming. But the reality is that day to day, there is exceptional overwhelm, whether it's at work, at home. They're anxious. They're fighting the urge to drink or engage in other behaviors that are not helpful. The reason is because everything in the market right now requires an individual to self-assess the distress in their body. They have to identify distress and then seek help. So by the time a clinician notices that a patient is struggling, it's already too late. One clinic last year lost $1 million and 14,000 no-shows. Statistically right now, we are seeing over 70% of patients disengage within 30 days. And when it's a completely digital program, it's over 90% in 30 days. And what that means is that from a patient perspective, 2 times more likely to relapse. From a provider perspective, they're losing in group practices on average $4,500 a week. And then for a payer, they're spending another $7,200 to readmit just to start the cycle of care over again. Providers cannot act on the data they can't see. The data does exist, but there's no intelligence layer for it. So right now, you go into a clinic, a provider is seeing you, and you are using manual pen and paper sometimes still to complete your assessments, and they are putting it into the EHR. Those data points become checklist items. They are not actually activating for engagement. And there are billing codes that exist that are not being used. So what we're missing here is that we don't actually have an individualized, personalized baseline that we are monitoring. If you don't have that, there's no early warning signs. In 2010, the HealthTech Act incentivized healthcare to go digital. And in the advent of the onset of COVID-19, almost $30 billion was invested into this ecosystem, much of it behavioral health. And that was a lot of overbuilding, lots of big investments. The problem is the tech stack wasn't ready. It wasn't until a few years ago that we could actually move at the speed that we need to be able to scale. That's why we're building MindMode AI now. MindMode AI is the proactive retention intelligence layer. We are identifying individual baselines, the early warning signals, think biometrics, behaviors, environment, identity. And then we have built the intervention engine for clinicians. We are passively monitoring these data points. I emphasize passively because all of the competitors on the market are active. They require the individual patient to be actively engaging in their apps. We're collecting data, we're establishing baseline, continuous monitoring. At some point, distress will be detected, and that's when a clinician is signaled for them to intervene. We're starting with intensive outpatient programs, often called IOPs. And as a quick overview on them, this is really for individuals who perhaps have an eating disorder, substance abuse a chronic mental health condition, maybe bipolar, schizophrenia. These are folks who are not doing care every few weeks. This is a 3 to 5 day program each week. We're starting with IOPs because they are pre-engaged patients. They've already self-selected to be part of this cohort. And payers are covering up to 90 days of care, even though folks are really only staying for about 40 right now. And there's a financial model that's already active and built in. The per diem on average looks like $300 a day, every day you keep your patient in care. The ROI case is simple and exciting. Our data indicates that the patient engagement increases at least 15 days when you combine the data-driven timing and the clinical communication. As I mentioned, payers are covering 90 days. Most of these programs are only keeping folks for about 40. So to do some math here, imagine we're at a medium-sized clinic. They see roughly 500 patients a year. When we increase the 15 days for all of those patients, we generate $2.25 million in revenue for them. And it only costs them $36,000 to get MindMode. That's an easy yes for me if I'm a digital health company to get a 60x return. The reality is that every digital therapeutic, digital health company in the market is our customer, and that's why the TAM is so large at $7 billion. This is all of USA Digital Health. This is the international expansion. This is all of our future big tech brain computing interface technologies that are coming onto the market that do not have the historical context yet because we are building that. But where we're going to the market is the place that already has buy-in, the IOP programs. We can easily achieve the 24 IOP contracts in the first 2 years, hitting 1.25 million ARR. Beyond that, we scale across the country to all IOP programs. It's virtual, it's hybrid, it is in person, the full gamut. I'm Correy. I am the founder of MindMode and a Silicon Valley VC-backed behavioral health entrepreneur. I'm a former CRO at a media tech company that we scaled and sold to Jeff Skoll's company. I've been doing 0 to 1, 0 to 5 for the last 20 years. My partner in crime, Andrew, he was the VP of engineering at a health tech unicorn. He's also been doing this for 20 years. Nothing makes us more exciting than solving problems in this ecosystem. I'm quite lucky. Cleo, our chief clinical officer, is the general manager at Carelon. She was formerly at Forge Health, but what matters most is that that is the backdoor to Anthem. And she is advising and guiding us into doorways we wouldn't have access to otherwise. Last year, I focused on building the MVP, testing the prototype. This year, we've moved into pilots. In fact, I have a new pilot as of about 2 hours ago. We are raising a $1.5 million safe that's going to continue with those pilot goals. We're looking at per diem revenue protection. We're looking at patient retention and the reimbursement code activations. As we move forward, I'm expanding the pilots. This matters because this also applies to chronic care management. It also applies for example, to Sonar MD or Livongo. With the growth, we are also integrating into the Healthy EHR. I've been in touch with the CEO, and this is a strategic partnership where they would become a channel sales partner. I'm raising a $1.5 million safe. This is opening in August. With that raise, we're taking the MVP simulations through pilot to 3 paying customers. We're capturing incredible data. It's a real game of how much money can I make them, and then integrating into the EHR. Every digital health platform that is sitting on data right now that it cannot act on is losing revenue, and every single day we have a chance to fix this. Thank you.